Business owners and organizations are feeling the effects of the coronavirus pandemic here locally in a big way. We're filming today at Contours Lingerie, and we're going to talk to award-winning designer, but also local owner of Contours Lingerie, it's Tia Lynn, later in the program, about how things have changed since we've learned the news, and some things are changing really daily. Right now, though, people are also wondering how to stay safe, and Dr. Ashley Woyak, owner of Forward Natural Medicine, is fielding a lot of questions about the coronavirus and what they should be doing. Thanks so much for joining us today.
Yeah, thank you for having me.
So we're going to share some of those questions with our viewers today and give them some pointers. First, of course, top of everyone's mind, how do we decrease risk of coronavirus?
Yeah, and I think most people do know that because it's on the news everywhere, but the big thing to understand is to stay home as much as possible. If you do have to go to work, isolate yourself from others like this, wash your hands as much as you can, constantly disinfect those areas that you're working around, doorknobs, things like that, and just don't touch your face.
Yeah.
So those are the big things.
It's interesting too, it's sort of practice makes perfect, because a couple weeks ago I was still touching my face, still interacting closely, and we've sort of learned over time how to get better at practicing some of these things. Let's talk more about symptoms too. The symptoms of coronavirus can be a little bit elusive. Sometimes there's people who are sick that don't know it, and that, of course, is contributing to some of the spread. So what should people do if they think that they might be sick?
Yeah, so if you have a cough, a fever, shortness of breath, anything like that, definitely stay home. Do not go to work. Don't isolate yourself even at home. And then if you are going to your doctor or urgent care, make sure you give them a call before you go, just so they have a heads up that it might be a coronavirus case. And then on your way there, wearing face masks, disinfecting things, washing hands, all of that.
Absolutely. And in your line of work, of course, you see people with all kinds of different health concerns, some underlying, some maybe more obvious, but let's talk about who's more at risk for serious illness.
Yep. So those over the age of 65, especially if they already have a serious underlying condition like heart disease, lung disease, diabetes. And then there was just a recent study that came out of Australia doing all this research on coronavirus that those with the weakest immune systems have the worst cases. So that's a factor too.
And isn't that interesting? That is a huge part of your line of work, is not waiting to treat the symptom, but really trying to start at the root cause, keeping people healthy and making sure those immune systems are able to fight off infection. So let's discuss that a little bit further. What are some things that people can do to keep their immune systems in check?
Yeah, and I just want to say, right now there's no treatment for coronavirus. It's a viral thing, so even if you go to the doctor, they're not giving you a medication. And just like if you come to see me, I'm not saying, oh, here's this perfect supplement or something that's going to cure it. That's not how it works. It's really more, like you said, how can we support your overall system so that you don't get sick, and then, or if you do, it's lessened. So the big thing is, obviously, good quality diet, good sleep, decreasing stress, light exercise, but there are a couple really good vitamins, supplements, things like that can help. Obviously, talk to your provider or something like that before you go on something, but big things that have been shown to help the immune system are vitamins like A, vitamin D, vitamin C. I check vitamin D on all my patients in lab work, and over half of them are deficient, and that's so important for immune system, so that's huge. Zinc, selenium, some people have heard of like elderberry, echinacea, ginger. I'm doing a ton of ginger root right now in smoothies, teas, all of that, and raw honey, and glutathione. Those are some of the biggest ones. So, but it can be simple fix. You don't have to go out to the store and get all these supplements. You can literally, like what we're doing right now at home, and I'm telling my patients to do, like in the morning, do a smoothie with a banana, some pineapple, spinach, raw honey, ginger, turmeric root. Throw that in there. That's great for your immune system. Make homemade chicken noodle soup with a ton of veggies, bone broth, stuff like that. We've been doing tea with ginger and cayenne and raw honey, things like that. So it can be little simple stuff like that at home.
So for viewers who haven't taken notes, are you still taking patients then by appointment, or how is that working?
Yeah, so obviously it's affecting everyone. So at my office, what I've been doing is screening patients before they come in. So are you having any symptoms? Have you traveled? What's going on with you? If we can switch it to a phone consult, we've been doing that, or telehealth, so via computer, things like that. Or if they do need to come in, I've been spacing them out as much as possible to make sure we're cleaning and disinfecting and all that between patients. So.
Well, thanks for the work that you do, Dr. Ashley. Thank you for the tips. Of course, Dr. Ashley is with Forward Natural Medicine. We're filming today at Contours Lingerie. Again, we'll be talking to owner Tia Lynn later in the program, but stick with us for more Wisconsin Women after the break.